it seems ridiculous that it had to be a Supreme Court in the land to tell us what we all know, which is men are men and women are women. And even if you dress up as a woman, that doesn't really make you a woman. Even if you believe you're a woman as a man, that doesn't make you a woman.
Dr. Az Hakeem is a consultant psychiatrist and has been the leading specialist in adult gender identity psychotherapy for 25 years. He is Honorary Clinical Associate Professor at UCL Medical School and an outspoken critic of transgender medicine and the current medical regime. He's the author of a couple of books, Trans, Exploring Gender Identity, and more recently, this one, DETRANS, When Transition is Not the Solution. So, Dr. Hakeem, thank you for joining me today.
Thank you for having me.
Tell me, can I begin straight away? Because we've had a ruling by the Supreme Court quite recently, only yesterday in actual fact, concerning the status of what a woman is and the nature of gender and sex. Can you tell us what your view is on that and what your thoughts are?
I think, I mean, it was an excellent ruling, and it seems ridiculous that it had to be a Supreme Court in the land to tell us what we all know, which is men are men and women are women. And even if you dress up as a woman, that doesn't really make you a woman. Even if you believe you're a woman as a man, that doesn't make you a woman. And the comments that have been raised have been, well, why go to all this fuss over such a minute proportion of the population? And what I say is that this term trans or transgender is lots of things. It's not just trans people that would used to be called transsexuals, of which there is a very small number. So men who, have surgery and then try and live in the opposite role, or women vice versa, very small amount. A much larger amount has always been what used to be called transvestites. There's always been far more transvestites than transsexuals. And then within transvestites, there's in my book, I describe 11 different subtypes. So working in the clinic that I set up and ran.
Sounds a complicated area. But
they're different because there are different reasons behind the cross-dressing. But the reason why this ruling was important is because the whole point of the transvestite is that they get something out of being in a women's vestiges. So that doesn't just mean clothing, it can be the women's spaces. So the transvestite can get turned on not just by putting their external womanhood on and off, but also by getting off by being in women's only spaces. So it's not just a ruling that affects a small number of transsexuals. It's a ruling that that stops a very large number of fetishists from getting turned on by being in women's spaces, and by women not being able to say, why is there a man with a penis in my changing room? Or why is that, so there's a and also women are more than half the population of the country, and it affects all women. So it's not just a ruling that affects a small number of people. It's a ruling that affects potentially a lot of women. And like the original Staniland question, would you be comfortable if your very young daughter was alone in a changing room with a man with a penis who claims to be a woman? Hopefully say, no, you wouldn't be. So it is a very important ruling. And it's a shame that it had to go all the way to the Supreme Court, but it did. And maybe that's a good thing because, it's black and white now.
As well as the practical outcomes of men in women's changing rooms and such like. I mean, there have been some pretty stark headlines in today's papers. I saw the Daily Telegraph put it this way. Its main headline is "Trans women are not women." Would you go along with that?
Trans women are trans women. A woman is an adult human female. Trans women are trans women. So a man can't become a woman and a woman can't become a man. At best, a woman can become a trans man and a man can become a trans woman, but you can't change your biological sex.
Okay, so biological sex is the fixed object.
Is your genotype and your phenotype is what you're born as,
Yeah.
your biology. And in the same way that you couldn't become a cat, you can dress up as a cat and meow all you like, but you're not a cat. You can become a trans cat, whatever that is. But, fantasy and fiction don't replace biology and fact.
Does this come down to the real difference between sex on the one hand and gender on the
Yeah,
other,
because
and the way in which society maybe confuse those two?
yeah, because sex is real and immutable. Gender is a social construct. We've invented it. It's like religion. It serves a purpose. But for lots of people, it becomes problematic, as does religion. And the it doesn't add any value to society. If we just stick to biological sex, it'd be much simpler.
Yeah. So would you go so far as to say that whereas sex is real insofar as it's testable, you can do an experiment, you can test someone's blood and say this is male or this is female. Gender is not real in that sense, and therefore being subjective doesn't have the same reality about it.
Absolutely, yeah. Gender's whatever you can you think it is. It's not the same as sex. And also it's not. Gender is completely determined by the micro society you're in. If you're in one part of the world, it might be feminine to have lots of metal rings around your neck or a t tongue plate, or somewhere else might be feminine to have, high heels and makeup and a dress. So it's not. It's completely society specific. And the idea that you're the wrong gender is never questioned as to what that means. And that's what I used to do in my therapy, would say, well, hang on, you say that you're the wrong gender. How do you know? You've never been the other gender. What is it? What does that mean? Nobody could ever tell me. And what I found was the transsexuals, the male transsexuals who wanted to be women, were all autistic on this autistic spectrum. They just talked about what women looked like. They couldn't
Well,
do anything beyond that.
what do you say to people then who come up with the phrase, I've been born in the wrong body?
But I asked them what that means. What does that mean? What do you mean born in the wrong body? Explain it to me. What does that mean? How do you know?
And the answer is they don't.
They don't. They don't. In the 25 years that I've been assessing people with gender identity, not one has been able to tell me what it is to be the opposite sex. Not one. And these are people who, when I saw people, I saw them far more in depth than any other clinician working with gender, because rather than going through a tick box and seeing them once every 6 months, and then giving them hormones and putting them for surgery, I was seeing them for um, an hour or an hour and a half in a group every week, and some of them for up to 10 years. So um, I was privileged to have high access into their minds and think with them over a huge amount of time, and not one of them could say what the opposite sex was, apart
What,
from, well,
what then
having
do you say to someone who presents to you and says, look, outwardly I'm a man, but inwardly I feel attracted to female things, or whatever females are attracted.
so I used to run a group, and
Yeah.
the group was much better than individual therapy, because individual therapy was yes, no, right, wrong, black, white, male, female, which is problematic for an autistic mind. But a group where everybody in the group had some sort of gender identity presentation, whether they're transvestites, transsexuals, or gynophiles, they did the challenging. So when someone says, I like feminine things, someone in the group would say, what do you mean feminine? Nothing is feminine or masculine. What do you mean? And it's amazing how people had gendered everyday things, a bit like I said in French, where everything's le or la. They presumed things to be feminine or masculine, whereas there was no real gendering at all. They had gendered it in their head. So they were very black and white, very autistic, and thinking, oh, these things are feminine, these things are male, whereas they were neither.
So when people present to you and they are, let's say, in a confused state of mind about themselves and
Mm.
their identity, how much of that is due to society having presented a genderized form of thinking then? And how much is society responsible for that?
I don't think it is. I think it's their own perception due to their own operating system in their head that perceives things in a very rule-based system. So I give the example of a spectrum of going from very gender underconfident to very gender confident. The gender confident person doesn't give two hoots about what you think about gender. They'll just do whatever they want to do. You know, you've got the bassist and the Manic Street Preachers wearing a dress. He's not pretending to be a woman. He's being subversive. You've got the new romantics in the 80s who all, and myself as a goth in the 80s, we all wore far more makeup than any woman did. We weren't being transvestite. We were being subversive and punk. Um, and so we can play around and be subversive without feeling a threat to our sense of who we are and our sex and gender. Whereas the very gender underconfident person will be slavishly adhering to the rules because they feel these rules are very black and white. And they feel that only men can wear these clothes, only women can wear these clothes, and it's very, very right and wrong. And I was talking to a young male, very autistic guy who is in about 19 or 20. And he said, oh, I know, I hate the idea of being male because men all wear suits and have short hair. Where have you been? Which rock have you been hiding under? I mean, it's like if only all men wore suits, the world would look a better dressed place, but they're not. Of course, men have long hair. They had very, very rigid rules about what men can do, what women can do. And what I tried to do, and the group would try and do, is break down this fictitious rule-based system, so they could do whatever they wanted to do within their own biological sex, in terms of how they look and behave and
So what what would be the solution here? I mean, would a suitable solution be, that's a radical solution, just stop talking about gender entirely, forget about gender, don't even refer to it, think of it as a fiction, and regard sex as the only thing which is scientifically worth talking about. Is that a solution to it?
well, I don't think it's a solution, but it's very sensible
No.
because gender doesn't add any value. It only confuses people, like you say, and then we invent conditions that pertain to this invented construct.
So So we've made a difficulty for ourselves. And I think what often happens is we have one objective set of standards, which is sex. We have a subjective set, which is gender. And very often these two are elided together. They are confused, possibly in mainstream media accidentally, possibly by malicious actors quite deliberately, so that what we thought of as sex then is referred to as gender, and what we think of as gender is referred to as sex.
And absolutely. And at worst, it's then conflated with sexuality as well. So sexuality and gender and sex have nothing to do with it's sexuality is what you fancy, gender is what sex you think you are. But gender is, like you said, it's superfluous to need gender. We should just have biological sex. And then when we're talking about sexuality, sexuality. Gender
Yeah.
is just a superfluous, unnecessary, unhelpful, confusing variable. And we should think of people not being happy with that variable as the same as people not being happy with other variables. So people who aren't happy with their weight and they get persecuted by that, the anorexics and the eating disorders, they are really unhappy about their weight. But we don't collude with them and say, yes, we'll help you lose weight. We say, well, let's think about this and try and help you overcome the distress you have about that particular variable. There are plenty of people as well who wish that they were a different race or a different color, but we don't try and surgically change them for that. We try and help them come to terms with who they are and accept who they are. So it's the only psychological condition which we adopt a very concrete approach rather than a thoughtful approach. And that's why I went into doing what I was doing because I did not see anyone in psychiatry thinking with these people. It was obviously a mental health condition because they were distressed. And to say it's not a mental health condition would be, I think, was a big mistake because they're clearly distressed. But rather than treating the distress, we give them what they say they want, presuming it's what they need. But what I found was that in my service, which was a therapy only service, it was an NHS service available to the whole of the UK when I ran it. 26% of my patients were people who had been given what they wanted and realized it was a mistake and regretted it. And none of them had been followed up. So, you'd think that having such a major overhaul to your body and a lifelong of hormones and all this sort of stuff, you'd have follow-up. But no, there was no follow-up studies. There'd be follow-up studies on if you had like a, you know, ingrown toenail operation, but not if you had to sex change. So these people were not followed up. They're invisible data. And some of them have gone back to the gender clinics, but most of them hadn't because they were embarrassed because they'd spent so many years convincing their GP, psychiatrist, the gender clinic, surgeons to give them what they wanted. They didn't want to go back and say they regretted it was a mistake. But 26 of my patients were regressors, which I wanted to write about in DETRANS because
Yeah.
the transition is not the solution. And if you look at various, if you Google, treatments for transgender, all they talk about is hormones and surgery. There's no emphasis on psychology or psychotherapy, and most people in the general public presume that to go through gender reassignment surgery, you have to have had lots of psychological input. You don't. There's none.
This is something which I've always found puzzling as an outsider and as a layman. I mean, you've got cases in here, many people's stories that they're utterly tragic and horrendous, really. But when someone presents to a doctor
Mhm.
and their mental image of themselves is different to their physical reality, it would seem to me obvious that you have to ask yourself which of those two is incorrect. And if it's a toss up between your mental image of yourself and your physical reality, which one is wrong? Well, I would have thought that the natural inclination to go to is your mental image because the reality is the reality. So what surprises me is that all of these people are not automatically treated on the mental side rather than on the physical side.
Mhm. Yeah, they're not.
Why
I
why
mean,
is why is why
I
does the
was the
medical
for the 12 years I ran the service, to my knowledge, I was the only psychiatrist specializing in psychotherapy for gender identity problems. The only one. And and I remember when I
that's
started doing
remarkable,
this,
really astonishing. That's just astonishing.
I used to when I started doing it in the year 2000, all my colleagues and friends were saying, "Why are you doing this? This niche weird thing?" I was saying because nobody else is. And then, 25 years forward, it's like the topic of the moment. But for most of the years I was doing it, people think, "What are you doing that? What are you doing that for?" That so I'm glad that people are seeing the importance of it. But I don't know why. Well, I suppose there's not enough provision for people to have psychotherapy in the NHS anyway. But it would be a more sensible approach. What I found is by doing groups, by putting them all in groups together, that within a couple of years of a weekly group, they had sorted the problem, which they had misidentified as being about their gender, but was actually about other things.
Yeah.
They were fine with their gender. So less than 2% of my patients went on to pursue any physical things. And the 2% that did said, well, I know I can never be a woman or man, whatever it is. I'm just doing this because I'm happy to be a trans person and I know it's not illegitimate, whatever. So they had a very um, rational understanding of what they were doing. Um, but most of my patients didn't. They were happy with who they were.
You talk about other problems that people have other than um, being trans as such, but things like
Well, trans isn't the problem.
orthogynephilia is one you mentioned. It's in your book, isn't it? Orthogynephilia is one reason why some people want to pursue a sex change operation and then find it's a tragic and terrible mistake at the end.
So I would say trans isn't the problem. It's the presenting symptom like a cough. Like a cough isn't the disorder. It's a presenting symptom of the underlying chest infection, lung cancer, whatever it is. So the presenting symptom of I'm trans is actually due to an underlying difficulty that's something else. And for men, like I said, for transsexual men, it was an underlying autism, where their sense of self was very different to everyone else because they felt they were different because they were different, because they were autistic to everyone else. And there was a search for a meaning as to why I'm different. Then the idea gets planted in their head, maybe you're the wrong sex, and they hone in on that one. Obviously, not all autistic people get that to that conclusion, but that those who do present as trans. And because they're autistic, they have no sense of how other people think or feel, because that's in relation to them, because that's the core deficit of autism, the lack of theory of mind. So they think that by putting on a dress and lipstick, that people will perceive them as women, because they have no sense that people wouldn't. So that's some. The transvestite, like I said, gets a kick or a thrill, sexual or otherwise, out of temporarily existing in the vestiges of women, whether it's women's clothing or women's spaces. The autogynephile is a sexuality. So typically a man who has sexual fantasies of having vaginas and a breast. And I use the very pure form of autogynephilia when I refer to autogynephilia. Blanchard, who coined autogynephilia, had various types. A lot of them, I don't think, added much more value than the definition of a transvestite. So when I use autogynephile, I use my refined definition, which is his pure form, which is men who have the sexual fantasy of having female bodily parts. And, I had a patient who, after spending many years masturbating to the fantasy of having a vagina, went to his GP and, you get 6 minutes with a GP. It's probably embarrassing to say I spend most of my time masturbating at the thought of having a vagina. So he said, I'm transsexual, because he thought that's what it was. And he said, well, you can go on a waiting list to Charing Cross. It's probably about 2 years. So he said, oh, I want to do something sooner. So he booked himself into a surgeon in Bangkok. And on the morning he thought, oh, I'm not quite sure I'm doing the right thing. And the surgeon said, well, I booked the operating theatre now. So he went ahead, just not to upset the surgeon. And of course, if you've got a sexually driven fetish about something, and if you have your physical castration, which is obviously part of having a vagina fitted, his sex drive is gone. So he woke up with this new neo vagina, no male genitals, thinking, "Oh damn, what have I done?" And then
The tragedy of the whole thing of society has encouraged that kind of thinking and produces huge suffering, I would think, in those people for the rest of their lives.
oh, absolutely. But you've got a culture where there's this, rather than being questioned or treated as, or being thought of this as unusual, or it's it's what we'd call reaction formation. It's doing the opposite. So we're celebrating it, embracing it. So all my regretters said, we wish we had someone like you who was just asking why and what at the time. Because whenever we came out with our false solution, our hypothesis that we're the wrong sex, everybody just supported us, affirmed us, and celebrated it.
They think it's the kindly thing to do.
Yes, but they said, one of them said they, at the age of 50 something, had realized it was a mistake 11 years later, and went back to his public sector employer, his family, his friends, and he said, why didn't you just ask me what was happening? I clearly was confused and struggling, and they said, because we were being supportive, because that's what we're meant to do. And he said, well, I wish you hadn't been supportive. I wish you just been normal with me and just. And I teach medical students, and I say, if your little brother knocks on your door and says, "Oh, I think I'm a girl," what would you say? And they all come out with what they're meant to say, like, "Oh, yes," and whatever, and "Don't worry," and all. But I said, no. What would you really be thinking? You'd really be thinking, "What? What do you mean?" And just question them. That's the normal response. That's what they need. They need a normal response. Really? What? What do you mean? What?
Is the root problem here much, much deeper, insofar as society itself has lost grip on what the truth is or the value of the truth? They exchanged maybe an absolute clear-cut definition of truth, of sex and such like, for a relative truth of your truth is different from my truth. Is that where the real problem lies here?
Yes, because we're in a post-truth age where truth and fact is less important than post-truth felt emotional fact. And the sad thing is, medicine has been taken over by this as well. So medical students are taught about gender rather than sex. Women are cervix owners, chest feeders, or whatever it is. But hopefully now with the Supreme Court judgment, women can be women again rather than just men holding a piece of paper saying they're women. Women can actually exist and feel they exist rather than just be invaded by anyone who says that they feel that they're a woman. We need to get back to reality because we've been lost in this sort of post-truth, non-reality meta-universe for so long. All the Royal Colleges of Medicine and Psychiatry have colluded with this ideology, which is not based on fact or biology. We need to get medicine back into facts, evidence base, and reality, rather than this mystical, mythical fantasy world.
We've come to the end of our talk, Az, but one last question for you, and that is, with this judgment now clearly been pronounced, and looking forward to the future, where do you see us in 5 years, 10 years time in terms of this kind of a problem? Have we turned the corner? Do you see hopeful in the future now, or do you see pessimistically?
I'd like to be hopeful. I've already seen online a guide that trans activists are putting out for trans people on how to continue using women's toilets and how to object and how to. So I don't think it'll be that easy, and I think it'll still be down to organisations and bodies and general places to enforce what the Supreme Court has said, which people might struggle with. Um, I'd like to be optimistic. Where I also see where we'll be in 5 to 10 years is a huge wave of kids who have been put through the Tavistock type model and been castrated and who regret it. They're increasingly coming through. So we're going to have a significant proportion of young adult eunuchs who have been missold a false solution by the health service.
And how will history judge us?
They'll judge us as being foolish for being convinced into this non-reality. And it'll be worse than the lobotomies, because at least there was some evidence for lobotomies, but there's no evidence for castrating people as a way of treating their mental illness.
Dr. Az Hakeem, thank you ever so much
Thank you
for
very much for having me, and I hope everyone who's enjoyed it gets the book on Amazon.
it's actually it's a very good book. It's in reading some of the cases, I find it's quite difficult to read because it's quite tragic. The tragedy is just huge, and but a brilliant book to read.
But
Um,
it's not just about gene transitions. It's basically a critique of gender ideology by a doctor who's worked in the field.
yeah,
Yeah.
it is. Anyway,
It'll help everyone win their dinner party conversations about gender.
thank you very much indeed. Take
Thank you
care.
for having me.